I think we're gonna get started as more people starting to trickle in. It's 6:34. Just to have a little bit of housekeeping to get out of the way before we jump to the workshop. But hi, everybody. Happy Thursday. My name is Taina. I am the Civic Engagement Coordinator with We Act for Environmental Justice. And to kick things off, today is, we're going to be doing a little bit of a lead poisoning prevention workshop, and a little bit of background on We Act. We Act's mission, we've been enacted since 1988, where we have worked to build, healthy communities by ensuring that people of color and or low income participate meaningfully in the creation of sound and fair environmental health and protection policies and practices. And Taisha, could switch over to you real quick.
Hi, my name is Taisha. I'm the community organizer coordinator with We Act. So you can join. So becoming a member at We Act, you'll join thousands of Northern Manhattan residents, fellows New Yorkers, and people around the country who are taking action to improve the environmental health of our community. So it only takes $25 a year just to become a member and be part of the community. I'll put our information down in the chat.
Thank you, Taisha. And that's a great way for us to be a member. It's a great way for you to participate in our event and just be aware of any key policies and events that are taking place throughout the city. A little bit of housekeeping before we start. This is the second or 10th year. No, I'm just kidding. Second year of Zoom. So if you are not aware of the speaker, you could put it on speaker view or gallery view. And as well as please mute yourself so that way background noises are not interrupting the meeting that's happening. If you have questions, we ask you to raise your hand, or you can also drop it in the chat and we'll be able to bring it up later on in the workshop. And for today, our agenda is we're hoping to first, we'll start off with a little bit of staff introduction, as well as we have a couple of announcements of events that will be taking place. We're also joined by a few Congress and Assembly person. We have Assemblywoman Nathalia, Senator Cordell, as well as the Office of Congressman Espaillat joining us. So we'll give them a couple of minutes to introduce themselves and speak for a little bit. And then we'll jump into our lead workshop and discuss, a few of the lead prevention policy agendas at the federal, state, and city level. So our team of beautiful faces, as you know, my name is Taina. We're joined by Taisha. Switch it over to you.
Again, hello, my name is Taisha. I'm the community organizer coordinator with We Act.
And we also have Pamela on the line as well, who is the manager of civic engagement.
Hi, everyone. It's good to see you all here. Thank you for joining us today.
And we have ourselves Yua, who is also on the line.
Hi, I'm Yuba Vosper. I'm the policy and regulatory manager for the federal office.
And the man that keeps us together, Chris Dobbins. I'm sorry I didn't get to include your picture, but he's a little bit of our IT, or not IT, he's our media person. Sorry, Chris.
Hi, everybody.
So this is our staff. This is just some of our staff. Actually, there's much more. You can see the rest of it on our website, weact.org. And to jump into our announcement this summer, We Act will be hosting a heat exposure study in Northern Manhattan. As you know, we experienced our first heat day. So if you would like to join the study, please take a picture of the QR code at the bottom where you'll be able to participate in the study. And basically what the study does is to gather data on the communities that have experienced a higher temperature, and usually this problem results from policies, extreme heat and policies and decisions that have created systemic environmental racism in New York City. So take a moment to just take a screenshot of, take the QR code, also take a screenshot of this nice flower that we have here. And we'll also be dropping that link in the chat so that you'll be able to participate in the study. And we are also having a team up cleanup for West Harlem on June 25th. Well, you'll be able to participate if you like to clean up the streets. If you walk down West Harlem, there's quite a bit of dirt, quite a bit of trash. So this is our community where we live, where we work, where we eat. And so we should come together to help clean it up. So tidy things up to make it look all nice and beautiful. So again, take a moment to take the QR code at the bottom, and you can also find this information on Instagram, Facebook, but it's happening this June 25th. It's from 10 a.m. to 1 p.m. and it's on the Saturday. Just giving you a little bit of a moment to grab that QR code, and you also feel free to take a screenshot of the screen. And so just jumping into our lovely guest that we have, Assemblywoman Hernandez. Are you on by chance?
Yes, I am. Hi.
Hi, Assemblywoman. Thank you for joining us. I'll give you a couple of minutes to, introduce yourself to your constituents and a little bit of discussion of your policies.
Thank you so much. Well, as you can see, I'm in my car in between events, but this, was an important meeting and conversation to have, because this year the caucus and the legislature did have a package of lead bills that I believe half got passed. So not every one of the package got passed, but this is momentum to continuing the fight to eradicate lead. We have a couple bills that Assembly members John Rivera from Buffalo has to make sure landlords cover insurance for lead exposure, to make sure that they are assessing buildings before they go on sale for lead exposure. Myself, I have a bill that would redefine the allowable blood levels of lead in our systems, because right now I believe it's like 5% that's okay. I don't think any lead is okay. So we're pushing to make sure that our laws change, our regulations change, because then we will change the actions that the city and state are taking to completely eradicate lead. So this is an incredible conversation, an incredible working group. I want to give props to We Act, to Pamela for leading this fight, not only locally, but in Albany, because we really have no time to waste. Still, there are buildings in the city, in the state, that have lead, and literally they just check every year to be sure that it's the same amount of lead. So it's just not working. Nothing's working, and people are still getting sick. And we've seen enough research in the science how lead can affect not just your physical health, but literally your mental health. So it's drastic that, we keep the pressure on to make sure that the regulations are changed and that lead is nowhere to be seen in our lives. So congratulations on this meeting and for the advancements that we made this year. I think we did make a big leap of progress in pushing towards these changes, but the fight continues as it does every year, because unfortunately, sometimes it takes more time. But I'm so passionate about this and passionate with this group to make sure that the conversation stays up in the front and center. So thank you so much. And any questions I'll take, if there are.
Thank you, Assemblywoman. Not sure if anybody has a quick question. Not as yet, but as you've mentioned, there's no normal level nor acceptable level of lead, and we do thank you for the work that you have done in pushing, the policy agenda as well as to eradicate this issue. Thank you for taking the time for joining
Absolutely.
us.
And part of the solution is getting more people behind it. So We Act has been definitely pulling in parents, community leaders, anybody. And the more that we grow, the more that we can see some change happen. So keep up the great work. I'm here with you, bringing in people as we can, but the work continues, and you should be proud of the progress.
Thank you, Assemblywoman. Thank you. And we'll talk soon.
Definitely.
Do we have Senator Cordell on by any chance? I wonder. Or do we have the office of Congressman Espaillat?
Yes, hi, I'm here representing Congressman Espaillat. My name is Lori Tobias Cohen. I'm a community affairs representative and constituent liaison. Proud to say that I've been with the congressman actually since the before he assumed this role when he was state senator. And his passionate concern about the welfare of the children in his district is evidenced in many, many of the policy choices that he makes and the things he promotes. And he is thrilled to partner with We Act on this initiative. He has himself instigated cleanups in Harlem and other parts of the district. And I really look forward to reporting on this meeting to him when I can be in touch with him tomorrow. And thank you.
Thank you, Lori. Thank you for taking the opportunity to join us. Thank you so much. And we're going to go ahead into our workshop. So before we start, just want to start engaging us and seeing, we have a quiz. If I could have the poll brought up, Taisha, real quick. Just to see how many of us here know what lead is to begin with, and have a little bit of information on lead. If I have to stop sharing my screen. Just gonna stop sharing quickly. Technical difficulties, guys, bear with me, please. Okay, now, Taisha, are you able to open the poll by any chance? Or
Do you need someone to read the choices?
yes, I think I'm gonna open it up right now.
The poll's already open.
They are open?
Yeah.
Perfect, thank you. I'm not seeing it, sorry, guys. Yes, Taisha, could help me read the questions, please? Sorry.
Okay, so our first question is, so it's what is lead? The choices that we have is naturally occurring metal, a type of leadership, harmful metal, and then choice 1 and 2. So we're just gonna give you a few more minutes.
Does this work? Can't see the screen, so you'll have to read the results for me, please, Aisha.
You want me to end it?
Yes, please.
The polls are closing now.
Thank you.
So we got 58% that said harmful metal, 32% said naturally occurring metal, and then 11% said choice 1 and 2.
That is correct. So yes, so lead is essentially it's a naturally occurring metal that's found in the Earth's crust. As you've all able to answer, it's a very toxic and harmful metal. And because it's extremely cheap and plentiful, a lot of building contractors, they tend to use it as much as possible, particularly to add it in paint. So in 1920s, actually, it was first added in gasoline to eliminate engine knocking, and then to use in paint in the early 1980s to sort of like accelerate, speed up the drying process, maintain durability, just finding ways to cut, corners and to have cheap results. And as we know, cheap result is not the best thing for us. But lead paint is one of the sources actually of lead exposure. There's other ways that you can get lead in your home. such as there's lead paint dust. So what that means is if the paint is very old, it starts cracking and it starts falling apart and it falls to the ground. And if it's left there, it creates this dust. And if you inhale it, it's very harmful or toxic to your body and yourself. And it creates these little paint chips. They're not actually edible chips. And if you have children that are around, they tend to pick it up and put it in their mouth. Or if you have pets, they tend to eat those. Lead can also be in your drinkable water. So leaded pipes is a very big issue, particularly in New York City apartment buildings. And where, if when you drink water, you taste like a metal taste, that's not a good sign. That's a sign that you have lead in your water. It could also be found in food, spices, cooking, where I know a lot of Caribbean households, there's like certain pots that you use to cook that are made of metal, certain utensils that you use that are made of metal. Those are bad to use as they cause and increase your significant risk to exposure. That can also be found in your soil, at work. Certain jobs in industry has a high or a significant risk of lead exposure. Also in your cosmetic, your makeup, your lotion, especially skin lightening products or skin whitening products, they tend to have a high exposure for mercury as well as lead. And your jewelry, so certain jewelries that are made with or amulets that are made cheaply or that are made with metal can be very toxic if exposed to your skin. And your skin is absorbing the lead particles, which over time can cause risk. And as well as your children's toys, as many of us don't know that a lot of our children's toys can be made out of lead. As I mentioned before, lead is very cheap and very plentiful. So a lot of developers and constructors, manufacturers, they used it in creating and making a lot of children's toys. And children, as put things in their mouth, and that is, bad for them and very, very harmful. I have a second poll. Could you please help me read the question? If possible?
Okay, so so the next question, okay. The next question is one of the most common places to find lead in your home is in the home. I'm gonna launch it now. Is it true or false question?
Yes. So I think it's like, it says one of the most harmful places to find lead is in your home, and it's true or false. So give everybody a couple of minutes to answer that question to make your choice selection.
So the polls are going to get closed now. And I'm going to share the results. So yes, 100% said true.
Yes, that's correct. And I'm sorry for sounding so happy, but thank you I'm happy you guys got that correct. Because most often at home, you face the biggest risk to lead, because your home is your safe haven, and most people spend 90% of their time at home. And as I mentioned a little bit before, more than half of the city's residential buildings were built using lead paint. And even though lead was banned in the 1960s, a lot of these older buildings, they still have lead paint in their walls, windows, doors, plumbing, and other surfaces. So pre-1978 homes with deteriorating lead paint is a huge significant risk. They often have like peeling, chipping, or in poor condition paint, as well as pre-1978 homes that are undergoing renovation or remodeling. And another source of lead is homes with moisture. So a lot of moisture or excess moisture in your home can cause your wood to rot. It can weaken the structure of your house or apartment. And so with your walls, that causes the paint to fall apart. So if your home was built before or even after 1978, you could be at a high risk of high levels of dust, and breathing in, household dust, your cooking spices, as I mentioned, ceramic, cookingware, metal dishware. So as this is, your place of residence, you have to be careful as to what it is you're being exposed to. And your home doesn't particularly have to be in a bad condition for it to be at risk of lead. It's just a matter of what you're bringing into your home. And as in mentioning that, lead at work, certain jobs that you do can expose you to lead. Even if you don't work in these conditions, always take care to wash your hands before eating, and because you never know what you're carrying with you. Wash your hands before you do everything, you guys. We're in the middle of a pandemic. And so one of those examples, if you work in auto repair, if you work at the factory, if you're an artist and you paint, or if you're a painter, if you deal with battery manufacturer, any other kind of manufacturer, if you're a plumber or a pipe fitter, or if you're in mining, or even if your husband or a significant spouse, or if you have a family member who is involved or working in any of these industries, they are at a significant risk of lead exposure. And what I would recommend is, in addition to, washing your hand before eating, always wash your hand the moment you come into your house. Change your shoes before stepping in, put that aside. Your working clothes, take it off and put it to the side so that your children, your family member are not exposed. Even if you work in an office or you work in a hospital, you may be at risk of lead because what you're breathing in and what you're taking in with you, because lead is in the environment, not just in paint and not just at home. So how does it enter the body, beside inhalation? So you can ingest lead, whether it's by accident or on purpose. And by purpose, I mean your spices, your food packaging. If you order food and it comes into certain packaging, then that could expose you to lead. For children, if children are putting toys in their mouth, or if they're picking things off from the floor and they're putting in their mouth, or if they're drinking water from leaded pipes, that's a significant risk of lead. Inhalation, so if you're inhaling dust, like if it's lead dust in the environment that you're inhaling, or the soil, if you're working in a garden, you're breathing it in, it's impacting your lungs. Dermal, so like meaning if you're touching it, it's absorbed through your skin, so it could be through your cosmetic products, or if just simply if you're just touching the dust, or if you're working on construction, you can also be exposed to that. Indonesia, so as well, if you had work done, some people I know, they have certain cavities removed and teeth removed, so they have metal teeth in place, so that could also be a source of lead exposure. And children, so any child can be exposed to lead. Significantly, children who are under 6 years old are at the greatest risk. And often they're exposed through lead, through peeling, lead paint and dust, and also a pregnant woman who contracts lead can easily pass it on to their children through prenatal causes, because it can cross, because lead can cross the placental barrier, so to your unborn child, so that can damage your baby's nervous system. And even a low level lead exposure in developing babies can have lasting effect and their learning behavior and their intelligence. So always make sure that children are kept away from dirt, away from dust, and to always watch what they're touching, wash your hands, because as we know, kids put their hands in their mouth quite a lot. And so the health effect of lead, it can harm a young child's growth, behavior, their ability to learn, their hearing and speech problem. Like just a small exposure, like the assembly woman had mentioned, like 5 millimeters can be very, very harmful, because there's no acceptable level of lead exposure. There's no acceptable level of lead poisoning. A small exposure can lead to long-term negative health effect. And children's bodies are still developing and growing rapidly. So anything that's contaminated that they put into their mouth can lead. And lead poisoning is very, very preventable. So we have to take the proper step to protect our children. They can get affected or at home as well as at school too. Their desks that they're sitting at, the water from the water fountain that they're drinking from, to always make sure to take the step to protect your kids. And one way, so just boiling your water also too doesn't really prevent that. You have to solve that by removing your pipes and by doing a blood test, which I'm going to cover a little bit later. As for adults, also short-term and prolonged exposure to health effects. So one of the earliest signs actually of lead poisoning, if you have like significant or constant abdominal pain, if your stomach is always in pain, if you have constipation, anemia, you're always tired, you're always weak. It's not always because you're overworking. There could be other contributing factors. If you have constant headache, you have a loss of appetite or memory loss, or if you're feeling some tingling or pain in your hands or feet. And prolonged exposure is your high blood pressure, heart disease, kidney disease, reduced fertility, and unfortunately, death. And just as with many symptoms, it's not that easy for you to identify whether you have lead poisoning because you don't automatically look sick or feel sick. And, there's other reasons that could be leading to this. So always take the step to check your home for signs of peeling paints. If you happen to have mold in your bathroom or mold in other areas, to check for that and to always report that to your landlord. Now, quiz number 3. Can anybody tell me what exactly is wrong with this picture that we're looking at? I think there's a poll that's associated with that.
The dust is left in the windowsill for anybody to ingest. And so the dust particles are in the atmosphere, and anybody in the family can be contaminated by the lead.
Exactly. Does anybody notice anything else also?
Yeah, there's chip peeling paint, and then there's signs of, if it's a window frame,
Yes.
right, then you have friction with the window going up and down, and and plus the wood is deteriorating.
I'll take one more answer.
Is it water damage?
Water damage, yes. As you can see, a little bit of signs here. And as you all correct, this is a windowsill. I thought, this is a windowsill you can see over there. But as you've all mentioned, if you take a look down here, there's some like paint chips. And if you look on the side, there's peeling. The paint is peeling and there's like dust particles. And if you have kids, they can just go in there, grab it with, grab it with their hands and then touch your face, touch your mouth. Definitely try to clean that. And there's some water damage as well that's happening. So always make sure to check for those. And if you can report it, definitely call 311 to report it or call your landlord to have and fix that up. Because just simply cleaning it up doesn't solve the problem, because as you see on the side, the paint is peeling and there's significant water damage that is happening. One more quiz before we continue on. Taisha, could you help me bring the poll, please? Why can't I do the polls?
Okay, sorry. The next question is, what is the best way to tell if your child has elevated blood lead levels? So the polls are up. And the choices are: check your child for lead poisoning symptoms, wait and do nothing until your child develops lead poisoning, ask your child's doctor to do a blood test, and then choice 1 and 3. So we're just gonna give you a few more minutes. Okay, we're going to close the polls now. And I'm gonna share the results. So 83% said 1 and 3, and 17% asked your child doctor to do a blood test.
Definitely. All of except number 2 is acceptable. Definitely don't wait and do nothing. Check with your child's doctor and check for signs of lead symptoms in your child. So now I've been throwing a lot of information at you. So what can you do? What can you do to fix any issue? So as we've mentioned before, keep your children away from peeling paint and home renovation. If you're having things being fixed in your apartment building, you can check and report with DOH to make sure that your landlord's renovation is being done safely and properly. Wash your floors and windows still often. Wash your children's hands and their toys too. If you work in outside in the industry, definitely remove your shoes before entering your home. Switch into flip-flops or house slippers. Use only cold tap water. So for when drinking, cooking, and making baby formula. But also, if you want, you can boil your water, but boiling water is not enough if you have leaded pipes. So you have to get to the root of the problem. Wash your clothes separately from the family laundry. If someone in your household work in construction, manufacturing, or any industry that is significantly exposed to lead. At work, don't eat, drink, or smoke in your work areas. If you're taking your break, try to step away. Take off your working gear. Wash your hands before you start eating your sandwich or any other meal. And I would recommend you to do that, or recommend that to your spouse or family member or friend to do that. Wash your hands and face with soap and water. Don't touch your face and eyes or mouth. Wear protective gear. And then before leaving, if you're able to wash and shower, do so. But once you get home, just as I've said, take off your work clothes, put that to the side, shower, wash your hand so that you don't contaminate and get anybody in your household sick. Also, you can test your water for free. So New York State has a free program, the free drinking water lead testing pilot program. A few of you may already know what it is. If you like to participate, take a moment to screenshot, and I believe we'll be dropping the email address and the phone number in the chat. So what you do is you send an email with your name, your phone number, if you have an email address, your location, for the sample, and as well as your county, so that they'll be able to tell you which laboratory to use. And what happens is, in I believe a week or 2 weeks or so, you'll get a kit that has like 250 milliliters sample containers, like bottles, and you'll use those 2 bottles to do a first draw sample and a flush sample. So what's a first draw sample? A first draw sample is when the water has not been used. So the water from your faucet, whether it's in your kitchen or your bathroom, wherever you're getting it from, has not been used for like from 8 to 18 hours. So try to do it in the morning. So like when no one has washed their hand, no one has run the water. So you don't rinse the bottle beforehand. So you place the container under your faucet, you fill it up, and then you close it. And similarly for the flush sample is it's a water collected after you let the water run for a good like 30 seconds. You let it run for a little bit, and you can do it the same day that you do a first draw sample. In fact, they recommend that you do it on the same day, and you take those 2 samples, you pack it up, and then you mail it to whatever designated laboratory they want you to mail it to. And then in a couple of weeks, you'll be able to get back your sample result, and it'll let you know what your lead levels in your water is. And so what do you do when that happens? So if there's indication that you have lead in your water, you can report that to your landlord. And if you see the sign of peeling paint, report it to your landlord. I know landlords can be very problematic at times and can tend to raise troubles. If you want, you can call 311 as well to report your landlord if they're not fixing the problem, or if they're threatening you for indicating that you have lead. Because it is the landlord's duty and responsibility to make any repairs concerning lead, as this is their building, and you're not the reason the person who is causing lead to happen or to appear in your home. You should also call your doctor to schedule a blood test for lead, either for yourself or your children, if you believe that one of you is showing signs of lead. And you can file a complaint with 311 if no action is being taken by your landlord. And then we have one final quiz before we move to policies, just real quick. And while that's being posted, so the acceptable levels or the normal level for blood is for lead in the children is 5 micrograms per deciliters or less, and for adults is 10 microgram per deciliters. But of course, 0 is the preferred level if you can.
So we're just gonna give you a few more minutes for the next question. The next question is, as long as your children does not eat paint chips, they are in any danger of lead-based paint, and it's a true or false question. We have a couple more minutes. Okay, and we're going to close the polls. So I'm going to share the results now. We have 100% that said false.
Exactly. So there's other ways your child can get lead besides eating chips. So also this year is the primary election. So pay attention to your members, who have been involved in lead prevention, what they have done. We have been pushing for a progressive lead package. Unfortunately, it fails during session year, and we'll continue to push for it. But pay attention in the June primary who's going to be in a ballot so that you can make a good voting decision. So I'm going to switch over to Yua to discuss a little bit of the policy agenda.
Having a little trouble unmuting myself. So good evening. I was going to say afternoon, but it's clearly evening. And thank you everyone for being here. My name is Yua Vosper. I am the Policy and Regulatory Manager at WEACT, and part of my responsibilities is toxins. So I'm going to take you through some of our federal landscape about lead. So the EPA has reported that an estimate that at least 6 to 10 million lead service lines exist in the United States. 6 to 10 million still exist in the United States. In New York alone, 360,000 lead pipes are still delivering water in people's homes, making New York the 4th highest in the nation. and then also 20 million people in the state. So lead service line, and the lead service lines per 100,000 people is 3,768. So a study called the Disparity in Risk Factor, Severity for Early Childhood Blood Lead among predominantly African-American Black children from 1999 to 2010. The study showed that, well, before I go to that, let me go about what is lead. So we just heard from our wonderful speaker about what is lead. So, you know, lead is a harmful neurotoxin, and it's poisonous, and it's incredibly incurable condition. But there is good news. It's completely preventable. We can prevent lead. So it's not like it's a disease that we can't control, and it's a disease that we don't have to be well, the toxin is an exposure that we don't have to be subject to. So what are some of the socioeconomic factors? Well, as I was saying before, disparity in risk factor severity for early childhood blood lead among predominantly African-American Black children stated that Black children continue to have the highest blood levels in the US as compared to either non-Hispanic white or Hispanic children. So the study, the most poignant thing about the study is that it shows that Black as a race, so the race factor is a strong independent predictor of more blood PB throughout childhood. So it showed that race is a very strong indicator on subjects of lead. And there has, in the administration, the Biden-Harris administration, there's been a big push to remediate lead with full service line replacements. The plan includes over 15 new actions from 10 federal agencies. And what this signals is a partnership, an interagency, where all agencies are going to work collaboratively to eradicate and replace all lead pipes within the next decade. But we need it now. We don't need to wait a decade. So, and also the CDC does report, you cannot see, taste, or smell lead in your drinking water. The best way to know your risk of exposure is to identify your sources of lead. So going back to, we talked in the previous slide about Black as a predictor. And I'm not to go too deep into it, but there has been a history of systemic racism, redlining, and inequalities that have permeated Black and brown communities. This has affected what types of homes we were able to afford to buy, and even if we could afford it, where can we go to live that'll make us feel safe, and the kind of inventory you have available to you, what kind of neighborhoods you have available to you. And so this also showed that many Black and brown people are living in older homes, antiquated infrastructure, and are exposed to more toxins because of, you know, older pipes, older plumbing in their homes. So I'm just going to move on to that because I don't want to repeat what we already heard. And so 9.7 million to 12.8 million pipes that are or may be lead spread across all 50 states. And these are including numbers that have not reported having none. So, you know, that's how many pipes are still in the United States. Next slide, please. Now, so I'm going to go into some components of the federal landscape. And first, I'm going to start with the Safe Drinking Water Act. So Congress passed this act to protect public health by regulating the nation's drinking water supply. However, the Safe Drinking Water Act is primarily focused on treatment as a means of providing safe drinking water. But I call it the SDWA, but we're not going to do acronym police here. We're going to call it the full thing. Safe Drinking Water Act applies to every public water system in the United States. And there was a 2011 amendment that redefined lead what is known as lead free. So lead free is now from 8% to a weighted average of 0.25% on wetted subsurfaces of plumbing products such as pipes, pipe fittings, plumbing fittings, and fixtures. And so now I'm going to take you through a very convoluted rule, the lead and copper rule. So the lead and copper rule is a complex set of regulations. It's been established, but it was recently amended in 1991 under the Safe Drinking Water Act. And the Safe Drinking Water Act authorizes the EPA to set enforceable standards. So as the Safe Drinking Water Act authorizes, and the EPA, the Environmental Protection Agency, implements. So they have authorized the EPA to set enforceable standards to reduce contaminants in drinking water to protect the public health in public water systems. So here's where it gets a little tricky. There is a lead action level of 15 parts per billion. And this is supposed, and we just read that this is to protect public health, right? 15 parts per billion is the lead action level, but there's no safe level of lead. So we clearly know that 15 parts per billion is not health-based. So these numbers are based on feasibility. What is feasible to take out of the water supply? So also, a key thing to remember is a lead action level is a measure of the effectiveness of the corrosion control, treatment, and water systems. It is not a standard for establishing a safe level in your home. So there is also a maximum exceedance level, and this is not even a violation. Exceeding the action level is not a violation. Violations only occur if you don't remediate. So there's clearly work we need to do into ensuring that the lead action level, that this lead and copper rule is more health-based. We have submitted dockets, we are working with other organizations, and we are even having meetings with the EPA because right now there is a push to do lead and copper rule revisions. In addition to that, we are advocating that the levels of lead go closer to zero as is feasible. There was recent legislation about water testing in schools where a lead action level was set to 0.005 milligrams per liter. And if New York State can do it, why can't the federal government? So we are pushing for closer to zero as possible. And also the bipartisan infrastructure law. We have all heard about it. It's been a saga for quite a bit, but the bipartisan infrastructure law will invest $15 billion to remove lead service lines across the country. So this is historic. So the bipartisan infrastructure law also invests $9 billion to address emerging contaminants in drinking water. This is primarily to address PFAS. And also there's $11.7 billion investment in the drinking water state revolving funds for drinking water priorities. And as I said, it's a historic investment, but several associations focusing primarily on safe drinking water say this is not nearly enough. There needs to be $1 trillion to fully address the drinking water infrastructure needs now in the United States. Next slide, please. So this is just a bit of the funding. It's not all of it, but there's $15 billion for lead service line replacement through drinking water state revolving funds. There is not a state match, but 49% will be provided to communities as grants are principal forgivable loans. $5 billion to address emerging contaminants, primarily PFAS in disadvantaged communities. And there is no state match required. And $11.7 billion for drinking water state revolving funds with the state match reduced to 10%. And we ACT are also working with Blue Conduit, a software company that maps lead service line inventory, and NRDC to take advantage of this opportunity of this investment. And we are going to map lead service lines in 3 pilot cities across the United States. And you'll probably hear more about that as that develops. Thank you for your time.
Thank you so much, Yua. So we're just gonna take a couple of minutes to go over the state and city policy and then make time for questions. So as I mentioned, there's a state bill package that, we have been pushing for. So we ask that you call your members. This is primary time, right? They're looking for your votes. So give a call to your members to see what they have done. Ask them what they have done concerning lead poisoning, prevention, and what they have done to help push legislation, and see if they support a free 0 level of lead in our water. And as well, in the city aspect, we have also been pushing a very progressive policy agenda, and that we've continued to advocate for. So call your council people, call them and be aware of who is on the ballot or who will be on the ballot, whether it is in June, whether it is in November or in October. So give them a call, and seeing what they have done, what they have implemented, and the work that they have done. So I want to give a couple of time to also please join. We have a Healthy Home working group. If you have any question, contact Charles Calloway. He is the director. He's the one in charge of the Healthy Homes working group, where they discuss, all aspects of maintaining a healthy home. So I want to give time for any questions that any individuals might have. I'm going to stop sharing my screen. See if we have what we have in the chat. Does anybody have any questions that they have on lead? Are you facing lead issues? Do you know anyone who has lead issues? And we'll ask, yes, Beatrice, you have a question?
Thank you so much for this information, because actually since I hear you talking about lead like that, and I did not realize that I have it in my house. So now I'm asking how to know that, because I have 2 kids, 1 13 and 5. So now how to know that I know now they are already exposed. So how to know like the symptoms, if there is any symptoms, so I can recognize that, I have a concern. So I have to ask the doctor to do the test. So is there a symptom, so I can, identify that?
There's some symptoms, you can check to see if they're having difficulties with memory. So, if they have problem remembering, lessons from work, if they have behavior problem in school, if they have irritability. So, if they're always annoyed, if they're not eating, if they have a loss of appetite, if you're noticing that they're sleeping a lot as well too. And also if, I'm sorry, I'm just trying to remember, there's one more too. If they have amnesia, the sign of amnesia, that's also lead. But the main step that you do is to schedule that blood test. Call their doctor and ask for a blood test. It's required by a provider to offer that. So call them, and then do the blood test. Yes.
Okay, absolutely. Thank you so much. I will do that.
In addition to that, I would like to add that if it's through the drinking water, or is it just lead paint, you think, or is it both?
Depends. Okay. The lead paint in the shower too. Every time I see mold, every time. So every time I have to buy stuff, sometimes chemical product to, especially every week. So that in the wall I see the paint. So now I can recognize that this is lead.
Beatrice, can you make sure that you follow up with Taisha, like your email address and your phone number? Taisha, absolutely. Can you direct message her and get that information from her so we can keep in touch with Beatrice?
Thank you.
Thank you, Beatrice, for sharing.
Thank you. Thank you so much. I'm gonna put information in the chat.
Yes, merci Beatrice. Vous connaissez moun pa nou ye. We
Thank you,
got
sir.
you. We got
Oh.
you. Vous connaissez haïtien là.
Merci.
Bien sûr, bien sûr.
Merci. Thank you.
Beatrice, Taisha will reach out to you in the chat.
Okay.
And thank you.
Thank you.
And if there's anyone else out there who'd like to share their circumstances, but don't feel comfortable enough sharing it in front of everyone, you can reach out to me, Taisha, or Taina. We will put our email addresses in the chat. Yua, is it okay if they reach out to you, or do you want us to funnel it through us?
They can reach out, but maybe just funnel it through, because we do the work on the federal level. But if you ever need me, we're here.
I added my email address, so feel free to jot that down, everybody. And for those that are calling in, it's taina.weact, WEACT @gmail.com. And for Taisha, it's for Taisha, TYISHA @weact.org. So please take a moment to jot this down. As Pamela mentioned, if you don't want to discuss it in front of everybody, you can send us an email separately, and I'll make sure to follow up with all participants after this meeting to make sure that your issues are being addressed. Don't let fear take control. Your health and your family's health is very, very important. Any comments? Any one last check-in? We want to thank you, everyone, for taking this initiative. We're going to try to do one more because, of course, there's a lot of information to throw your way, but we want to make sure you're taking the proper step to protect yourself. Do your blood test. Also check your drinking water. It's free. Your blood test is covered by your provider. It's a requirement actually by law. And advocate. Check to see what your council member and your assembly member is doing, and we'll be advocating on your behalf. We'll be pushing continuously for a lead prevention, for zero lead levels in all drinking waters and plumbing pipe. But hope everybody have a wonderful, wonderful evening. Please take care of yourself, take care of your family as well.
Okay, staff, please stay on.